Hello guys, and welcome all of you to today's session of PYQ Shots, and let's begin with today's question, guys. A young female comes to emergency after consuming 100 tablets of aspirin. What should be the next step in management? Right, look at the options. Option A, give sodium bicarbonate to alkalinize urine. Option B, N-acetylcysteine to replenish glutathione stores. Option C, pralidoxime or PAM. Option D, glucagon. So what is the answer, guys? Pause the video, let me know the answer in the comment box. Okay, so I hope you have commented. Now let's get to the question here. And what is the answer? Guys, it's a case of aspirin toxicity. Aspirin is an acidic drug, and for that, what I do, option A, I alkalinize the urine by giving sodium bicarbonate. Now, this MCQ has been asked earlier as well, right? So, PYQ number one, what they had asked you is a patient developed toxicity to some drug for which urine was alkalinized. Which drug toxicity the patient had developed? Your answer was aspirin. So it is an MCQ which was a molded form or reverse form of this particular MCQ. What are other things they can ask you? They can ask you is, what else can I do in aspirin toxicity? Guys, I can do dialysis. And what is the indication for dialysis in aspirin toxicity? That is, if the patient develops pulmonary edema. So there's two PYQs which they can ask with respect to aspirin toxicity. Look at the option B. So let us see what are the other PYQs related to other options. Option B, N-acetylcysteine to replenish glutathione stores. Where do I use N-acetylcysteine, guys? I use it in case of acetaminophen or paracetamol toxicity. So what are the PYQs with respect to paracetamol toxicity? Number one, paracetamol toxicity. It is seen at which doses? Right, PYQ number one. Your answer is more than 10 grams or more than 150 to 250 milligrams per kilograms. PYQ number two, paracetamol toxicity can kill the patient. Fatal at what dose? Your answer is more than 20 grams. So this is PYQ number two. PYQ number three, which metabolite of paracetamol is responsible for hepatotoxicity? And your answer is NAPQI, right? NAPQI. PYQ number four, whenever there is paracetamol induced hepatotoxicity, what is the histopathological finding in the liver? Your answer is centrilobular necrosis with periportal sparing. PYQ number five, what is the drug of choice for paracetamol induced hepatotoxicity? And it is in the option B, it is N-acetylcysteine. And the second, why do I use N-acetylcysteine? It is to replenish glutathione stores. There is one use of N-acetylcysteine. Second, N-acetylcysteine is a blocker of NAPQI as well. That is how it helps us in hepatotoxicity. PYQ number 6 with paracetamol. What do I do if the patient does not respond to N-acetylcysteine? The patient goes into fulminant liver failure. The only thing that is possible now, it is to go for an emergency liver transplantation, right? PYQ number 7. For which of the following drug-induced hepatotoxicity we might have to go for liver transplantation? Your answer was paracetamol. Your answer was paracetamol. PYQ number 8. Which is the most common cause of drug poisoning? Paracetamol. PYQ number 9. Which is the most common cause of drug-induced liver failure? Paracetamol. So you can see all of these are the MCQs which have been asked with respect to paracetamol. Option C, PAM, pralidoxime. So all of you know where is PAM used. So guys, PAM, PYQ number 1, pralidoxime, where it is used. Your answer is organophosphate poisoning. PYQ number 1. PYQ number 2, where it is not used. And then your answer is carbamide poisoning. I cannot use PAM. PYQ number 3, what is the most specific drug for organophosphate poisoning? Your answer is pralidoxime. But if they ask you, PYQ number 4, which is the drug of choice for organophosphate poisoning or carbamide poisoning, your answer is atropine. PYQ number 5, whenever I give atropine to a patient of organophosphate poisoning, how do I know that the patient had been adequately atropinized? Most commonly used marker, pupil size. PYQ number 5, which is the most specific marker of adequate atropinization, and your answer is not pupil size, it is normalization of respiratory secretions. So these are some of the PYQs which have been asked with respect to PAM or pralidoxime. Option D, glucagon. Only one PYQ, what is the antidote for beta blocker toxicity? Your answer is glucagon. So guys, this was the PYQ short session for today. Tomorrow I'll be back with another PYQ short. Till then, bye-bye. Take care.